first, he seemed like a normal and capable student who easily blended in with others. However, small problems began to appear. He often manipulated others to do his responsibilities. He showed little concern for other people's feelings or struggles. He frequently ignored rules and showed no fear of consequences. When confronted, he reacted with sudden aggression. After the incident, a psychological evaluation was conducted. The evaluation revealed a pattern of manipulation, lack of empathy, and disregard for rules. These traits are consistent with sociopathy, which is associated with antisocial personality disorder, a condition studied in psychology.
Sociopathy is a mental health condition where an individual disregards what is right or wrong and ignores the rights and emotions of others. People with this disorder may intentionally provoke or upset others and often manipulate or treat people in a harsh or uncaring manner. They typically show little to no remorse for their actions. Researchers have long studied sociopathy in an effort to understand why some individuals repeatedly violate social rules and laws without showing guilt or remorse. Modern psychological studies suggest that sociopathy may develop due to the combination of biological, psychological, and environmental factors. People are unique from one another, but they can still be classified based on their personality. Some personality traits, such as sociopathy, may demonstrate impaired moral judgment, poor impulse control, and a tendency toward manipulation or aggression. These characteristics can increase the risk of involvement in criminal or deviant behavior. However, it is important to recognize that not all individuals with sociopathic traits become criminals. Many factors influence whether a person engages in criminal activity. The idea behind sociopathy began in the early 19th to 20th century when doctors tried to understand people who repeatedly violated social rules but did not appear insane. One early concept was moral insanity, proposed by James Cowles Pritchard in 1835. He described individuals who seemed intellectually normal but showed no moral restraint and who behaved cruelly, impulsively, or irresponsibly. Later, psychiatrists began using the term sociopath. Sociopathy emphasized that social environment might produce antisocial behavior. Modern psychiatry shifted terminology when diagnostic systems were standardized, especially through the Diagnostics and Statistical Manual of Mental Disorder, or DSM. Instead of labeling people as psychopaths or sociopaths, the DSM created the diagnosis antisocial personality disorder. The reason for the change is number 1, scientific consistency. The older terms were inconsistent and loosely defined. Secondly, antisocial personality disorder is based on measurable behavioral patterns. And lastly, terms like the sociopath became heavily associated with the media and crime, which blurred scientific meaning.
Sociopathy, clinically known as antisocial personality disorder or ASPD, is a mental health condition characterized by a persistent pattern of disregarding the rights, safety, and feelings of others. According to the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, individuals with the disorder often display manipulation, deceitfulness, impulsive behavior, and a lack of remorse for harmful actions. These behavioral patterns typically begin during childhood or adolescence and continue into adulthood. One of the most common symptoms of sociopathy is a lack of empathy. Individuals with this disorder often struggle to understand or care about how their actions affect others. Because of this, they may frequently lie, manipulate people, or violate social rules without feeling guilt. Another key symptom is impulsivity and irresponsibility. People with sociopathy may act without considering the consequences of their behavior. They may also have difficulty maintaining stable relationships, employment, or responsibilities. Some individuals with sociopathy may also display aggressive or hostile behavior, including irritability, verbal abuse, or physical aggression. Even after harming others, they often justify their actions or blame others instead of accepting responsibility. Researchers believe that sociopathy develops due to a combination of biological, psychological, and environmental factors. Biological studies suggest differences in brain areas related to emotional regulation and impulse control, particularly in the prefrontal cortex and amygdala. Psychological factors such as conduct disorder during childhood, as well as environmental influences like abuse, neglect, or exposure to violence, may also contribute to the development of sociopathic traits.
Sociopath may influence decision-making because the person may act quickly without thinking the consequences. They may also have little concern for the other people's feelings, which can lead them to make selfish or risky decisions. Because of this, some sociopaths may lie, manipulate others, or break rules to get what they want. There are also some risk factors that may increase the chance of aggressive or deviant behaviors. These include grow up in a violent or unstable home, genetics, early trauma, neglect, seeing violence as a child can affect empathy of self-control and develop. The environment may also matters if manipulate or antisocial behavior is rewarded. It can become a habit. Brain differences relate to emotion and self-control may also play a role. Many people misunderstand sociopathy because of movies and TV shows. Sociopaths are often shown as dangerous criminals, but many can hold relationships, work in normal jobs, and even appear charming or competent. The biggest mistake is thinking sociopathy is harmful. While their lack of empathy can hurt relationships, sociopaths can also be strategic, adaptable, and emotionally taut. In short, sociopathy is a mix of emotion detachment, unique thinking patterns, and environment influences, which shapes how someone sees right and wrong. Most individuals with these mental conditions are not dangerous and can live normal lives, especially when they receive proper and help and support.
The prevention and intervention of sociopath, clinically categorized under antisocial personality disorder or ASPD, emphasizes a shift from curing personality to managing behavior and disrupting environmental triggers. Because sociopath is largely viewed as an acquired condition resulting from early childhood trauma, neglect, or unstable environments, the most effective prevention occurs during the conduct disorder phase of childhood. Programs such as parent-child interaction therapy or PCIT and social emotional learning or SEL are critical during these formative years. These interventions aim to foster secure attachment and teach children that cooperation and emotional regulation yield more consistent rewards than manipulation or aggressions. By addressing adverse childhood experience before a child reaches age 15, clinicians can often steer them away from the neurological hardening that characterize adult sociopathy. In adulthood, intervention becomes significantly more complex because individuals with sociopathic traits often lack the internal distress or remorse required to seek change voluntarily. Consequently, clinical efforts often focus on self-interest models of therapy rather than traditional empathy-based counseling. Cognitive behavior therapy, or CBT, is frequently used to demonstrate how antisocial behavior such as theft, violence, or deceit ultimately lead to personal losses like incarceration or financial instability. By appealing to the individual's logic and desire for personal gain, therapists can help them adopt more pro-social behaviors. Mentalization-based treatment (MBT) further assists by training the individual to recognize the others have independent mental states, which can dampen the volatile, reactive aggression typically of the sociopathic subtype. While there is no pharmacological cure for sociopathy, medication plays a supporting role in managing the disorder's most dangerous symptoms. Psychiatrists may prescribe mood stabilizer such as lithium or valproate to reduce the explosive irritability and impulsivity that often lead to legal or social consequences. In some cases, second-generation antipsychotics are used to curb severe impulsive aggression. Ultimately, the modern benchmark for success in treating sociopathy is harm reduction. The goal is rarely to instill deep empathy where it may be biologically or environmentally absent, but rather to ensure the individual can maintain functional stability, hold a job, and navigate society without violating the rights of others or returning to the criminal justice system.
Sociopathy, often understood as a form of antisocial personality disorder, is a complex condition marked by persistent patterns of disregard for others, impulsivity, and difficulty forming genuine emotional connection. It is influenced by a combination of environmental factors such as upbringing trauma or social conditions, and in some cases, biological predispositions. Individuals with sociopathic traits may appear charming or functional in society, but they often struggle with empathy, responsibility, and long-term relationships.